Children died not because their injuries were unsurvivable, but because we lacked blood, antibiotics, and the most basic supplies that are readily available in any large hospital anywhere else in the world. I did not see or treat a single combatant during my 5 weeks in Gaza. My patients were 6-year-olds with shrapnels in their heart and bullets in their brains, and pregnant women whose pelvises had been obliterated and their fetuses cut in two while still in the womb. Civilians are now dying not just from the constant airstrikes, but from acute malnutrition, sepsis, exposure, and despair. Between my 2 visits to Gaza, I witnessed a sharp decline in patients' health, driven not just by injury, but by worsening hunger and malnutrition that left their bodies weaker, their wounds slower to heal, and their survival far less certain. And let's not forget, this is a man-made catastrophe. It is entirely preventable. On March 18th, the ceasefire was violated by Israel. That day, I witnessed the most extreme mass casualty event of my career at Nasser Medical Complex. 221 trauma patients arrived in one morning. 90 were dead on arrival. Nearly half were severely injured children. No health system on earth could cope with this, least of all one that is besieged and starved of supplies. Hospitals are meant to be sanctuaries. Healthcare workers and first responders are supposed to be protected. Children are supposed to be protected. In Gaza, these protections are simply gone. Every day, the distinction between combatant and civilian is erased. Most of my patients were preteen children, their bodies shattered by explosives and torn by flying metal. Many died. Those who lived often awoke to find their entire families gone. Last year, I published in the New York Times a survey of 65 American healthcare workers who had served in Gaza. 83% of them reported seeing children shot in the head or the chest. I personally treated 13 such cases in my 2 weeks at European Hospital. According to the War Child Alliance, nearly half of Gaza's children are suicidal. They ask, why didn't I die with my sister, my mother, my father? Not out of extremism, but out of unbearable grief. I wonder if any member of this council has ever met a 5-year-old child who no longer wants to live. Let alone imagined a society in which so many young children feel this way. And what astonishes me is not that some children in Gaza have lost the will to live, but that any still cling to hope. My Palestinian friends, mostly healthcare workers, no longer speak of resilience or even survival. Parents memorize their children's clothing in case they must identify their remains later. They pray for one piece of bread to give them before they sleep so that their children might die less hungry if they are killed at night.